Hey everyone, thanks for tuning in. Today let's dive into something that's crucial for all healthcare professionals, MIPS and MACRA. This is especially important as we approach the 2027 penalties. So grab a cup of coffee and let's get started. First, let's break down what MIPS and MACRA actually stand for. MIPS is the Merit-Based Incentive Payment System, and MACRA is the Medicare Access and CHIP Reauthorization Act. These programs were designed to shift healthcare from fee-for-service to value-based care. Essentially, they reward healthcare providers for giving high-quality, efficient care. Now, why should you care about 2027? Well, the penalties are going to be more severe if you don't comply. The penalty rate will increase to a whopping 9% of your Medicare reimbursements. That's quite a chunk of change. Let's talk about how you can avoid these penalties. First, you need to understand the 4 performance categories: quality, cost, improvement activities, and promoting interoperability. Each of these categories has its own weight and scoring system. Quality, for example, makes up 45% of your MIPS score. That's nearly half. So, what do you need to do? For quality, you'll be reporting on various measures like patient outcomes, safety, and efficiency. It's essential to choose measures that are relevant to your practice and ensure you're meeting the benchmarks. Next, we have cost. This covers the resources used in patient care. You won't have to report anything directly, but Medicare will analyze your claims to determine your score. Make sure to provide cost-effective care without compromising quality. Improvement activities are all about engaging in efforts to improve your practice. This could be anything from patient safety initiatives to care coordination. These activities make up 15% of your score and are relatively easy to implement. Finally, promoting interoperability focuses on the use of electronic health records. You'll need to show that you're using these systems to improve patient care and share information securely. This category is worth 25% of your MIPS score. So you might be wondering what happens if you fall short. If you don't meet the performance threshold, you'll face those hefty penalties in 2027. But if you do well, you could actually earn positive payment adjustments. It's a win-win. In conclusion, staying on top of MIPS and MACRA is crucial as we approach 2027. Focus on the 4 performance categories, and always aim to improve the quality and efficiency of your care. By doing so, you'll not only avoid penalties, but also enhance your practice and patient outcomes. Thanks for watching. Don't forget to like, subscribe, and hit the bell icon for more updates. Until next time, keep providing exceptional care.